Hi, this is Dr. Bock. Today I'm going to talk about a treatment of brain fog. Now, brain fog is not a disease, it is a condition. Um, and it usually means that the person is not thinking well, has memory problems, word retrieval problems, um, fogginess, fuzzy brain, cloudiness, getting lost in a parking lot when they park their car. Just different aspects of their brain is not functioning. Now, this can be caused by Lyme disease, but it can also be caused by other things. Things that can cause brain fog are metabolic abnormalities, nutritional deficiencies, menopause in women can present with that, depression, chronic fatigue syndrome, etc. So we have to think of all this and do appropriate workups. So we can do nutritional testing, neurotransmitter testing, hormonal testing, to see if there's any abnormality that can be affecting the brain. Once you've done that, and those things have been ruled out, if it is Lyme disease, you can treat with oral antibiotics, IV antibiotics. Rocephin IV is the gold standard for treating neurological Lyme. There are alternative methods that you could also use, like ultraviolet light, ozone, etc. There are techniques that can delineate what the problem is. You can do an MRI of the brain to rule out something like MS or any kind of lesion that could be masquerading as brain fog. You can also get brain fog in someone who's on certain medications. You can also get it in someone who's on chemotherapy. So there are many causes like that. You then can do a brain SPECT scan, which will show abnormalities, but that can also be abnormal in depression or chronic fatigue. Another thing you could do is neuropsych testing, which is testing for a day, day and a half with a specialist, a neuropsychologist, who tests your brain function with processing problems, memory, visual and hearing, spatial representation. Once you've done this and you've delineated that it is Lyme, are there anything that could augment that, your treatment? And you could do nutritional therapies, which are many, and it depends on the problem, or you can give nutrients that increase brain function. One of them is called L-acetylcarnitine, which is a brain antioxidant. Another one is ginkgo. Another one is pregnenolone. So and another one is vinpocetine, which is derived from a snail, and vinpocetine increases oxygen and blood sugar to the brain, and it's a so-called smart nutrient. So there are many things that you could do for brain fog to help you. Of course, you have to rule out what the condition is. I hope this has been helpful. Have a great day.